A very good morning to our honorable judges, fellow colleagues, ladies and gentlemen. I'm Dr. Keh Xin Een, and today I'll present to you my research with my fellow co-researchers, Prof. Nia Wei Chong, Dr. Lau Xiang Ling, and Dr. Yeo On Teck on the topic posterior teeth injuries in maxillofacial trauma. When maxillofacial trauma occurs, usually the anterior teeth were injured. However, we notice the significant occurrence of posterior teeth injuries as well. In the past few years, there were several studies done on dental injuries with at least 26 classifications. Some of them are very familiar to us, like Anderson and Ellis classification. However, have you noticed most of them are focused on anterior teeth? Several researchers have tried to look into posterior dental injuries, and one of them was Lombard et al., who actually proposed a classification for posterior dental fractures. Due to the limited research in this topic, we notice that the posterior teeth are more often than not overlooked in maxillofacial trauma patients. Therefore, we sought to research on the prevalence of these injuries, their characteristics, and correlation to maxillofacial trauma. We aim to classify them as well as to look into the mechanism of these injuries. Our hypothesis is posterior dental injuries do occur following maxillofacial trauma. They can be multiple, but not severe, and are often associated with the type of facial fractures. This is a retrospective study comprising of 559 clinical records of maxillofacial trauma patients that we received from USD of Malaya. We reviewed the records and extracted the data. We then narrowed down the subjects into 160 patients who sustained posterior dental injuries. The analysis of the data was done using Microsoft Excel and SPSS. Moving on to the results. In general, the 559 patients were the victims of maxillofacial trauma between year 2009 to 2016. We notice most of them are Malays, males, and young adults who are in their 20s. Two-thirds of them have dental injuries, resulting in a total of 2,043 teeth injured, giving us an average of 5 to 6 teeth injured per patient. This is a chart showing the numbers of teeth injured by arch. Blue indicates maxillary teeth and orange indicates mandibular teeth. We can see from the middle of the chart, anterior teeth injuries constitute the majority of dental injuries. But we notice there's a significant occurrence of posterior teeth injuries as well, especially the maxillary premolars. We also look into this patient by the type of their maxillofacial trauma, in which we notice that injuries to the mandible as well as a combination of maxilla and mandible region are the most common injuries. Based on the dental injuries, we noticed tooth fracture was the most commonly seen posterior dental injury. Hence, we further investigated the types of crown fracture in which we noticed vertical short-out fracture is the most common type of fracture to the posterior teeth, followed by no inflammation, horizontal fracture, and cracked line. Buccal and lingual wall showing off fracture are very commonly seen. For patients who sustain soft tissue injuries only, avulsion is the most common type of posterior dental injury, similarly in patients who sustain combination of maxilla and mandible trauma. Whereas in patients who sustain trauma to maxillar region or non-tooth-bearing region, concussion is the most common injuries recorded. As for patients who sustain trauma to mandible only, short-off fracture was the most common type of posterior dental injuries. Moving on to discussion. Our demographic data is similar to other reports from other countries, except for the fact that we have a high percentage of dental injuries in relation to maxillofacial trauma, which is 68.34%. This data is 2 to 3 times higher than that reported in other countries, except in Austria and China. Besides that, we also have found that males have a significant higher risk than females to sustain dental injuries following maxillofacial trauma. We found 4 characteristics of posterior teeth injuries in relation to maxillofacial trauma. Interestingly, there are more upper premolars involvement than mandibular molars, which is opposed to what was reported by Racine et al. And Torrent et al. Short-off fracture was the most common type of crown fracture, a finding that has never been reported elsewhere. Dental injuries are most commonly found in condylar fracture. They are usually more frequent and more severe in bilateral condylar fracture rather than unilateral, which is supported by Silvernoinen et al. And Zhou et al. A comprehensive classification of posterior teeth injuries is important to arrive at the correct diagnosis and treatment planning. Ajayi et al. Used the term cast fracture in reporting posterior teeth trauma. Although the term cast fracture has been proposed by Anderson, it is felt that such a description may be a bit too general. Lombard et al. Tried to address this shortcoming by coming out a new classification system. This is a classification proposed by Lombard et al. As you can see, they try to classify posterior teeth injuries into type 2 horizontal and type 3 vertical. However, this classification system did not describe the walls affected. So, we propose that Division 1 of type 2 fractures are redefined by describing the location of the cups involved, with M noted as mesial, D as distal, B as buccal, and L as lingual. P and SG are also added to describe the pulpal involvement and the subgingival extent of the shirt of cups. This information will provide better indication on the treatment need, treatment outcome, and long-term prognosis. It is believed that dental injuries can be results of direct and indirect trauma. When direct trauma occurs with a blow to the mandible, the force either breaks the posterior teeth, the jawbone, or both. Whereas in indirect trauma, it is postulated that when whiplash-like movement occurs during motor vehicle accident, impact is received by the jaw. The force is then transmitted from the chin of the mandible to the condyle and causing condyle to absorb the force and fracture. This explains the high incidence of condylar fracture compared to others. At the same time, this impact also causes forceful occlusion between upper and lower dentition. As a result, the posterior teeth becomes subjected to shearing energy to either the buccal or lingual palatal crown cups, especially on the maxillary premolars, as seen in this study. Since this study was designed retrospectively, the original state of dentition prior to maxillofacial injuries is unknown due to the lack of dental records. The information obtained in this study is largely dependent on quality of examination, data entry, and reporting. So, to overcome this limitation, a prospective study undertaken by calibrated healthcare personnel on a standard data entry form should be carried out to improve the accuracy of the results. To conclude, non-complicated posterior dental injuries are found to occur with different types of maxillofacial trauma. Crown fractures occur more frequently in mandibular fractures than other types of injuries. There are two types of impacts that inflict posterior dental injuries, which are direct and indirect trauma. Indirect trauma results in fracture to the mandible and/or the shearing off type of crown walls fracture. This type of fracture should be included into current classification system. Our hypothesis is accepted. I would like to express my gratitude and acknowledge my co-researchers, Prof. Niao, Dr. Lau, and Dr. Yo. For those who are interested, these are the references. And this is the end of my presentation. Thank you very much for listening.